is a breach in the integrity of the skin, bleeding occurs at the site. Platelets immediately respond and release substances that cause vasoconstriction or vasospasm to control the loss of blood. This effect can last as long as 30 minutes. When the blood vessels begin to relax, the platelets assume their primary role of forming a stable clot to seal off the injured vessel. This process is enhanced by the leakage of adenosine diphosphate, or ADP, from the damaged tissue. The clotting cascade, which is composed of numerous extrinsic and intrinsic factors that come together to create prothrombin, thrombin, fibrinogen, and finally, fibrin, the latter of which provides strength and stability to the platelet aggregate. Platelets also release cytokines, which are chemicals made by some cells that have defense against infection as they phagocytize debris and microorganisms. Mast cells also aid in this process by releasing histamine. Macrophages are the second line of defense. These cells are involved in several different activities. First, they phagocytize bacteria at the wound site. Second, they are involved in the production of growth factors that stimulate fibroblast migration and proliferation, the synthesis of connective tissues, and the creation of new blood vessels, which is called angiogenesis. Third, macrophages secrete interleukin-1, a chemical that initiates the third phase. Specialized fibroblasts work in aiding tissue contraction, or pulling the sides of the wound together, while keratinocytes or epithelial cells acute events, including second and third degree burns, significant traumatic injury, or dehiscence of surgical incisions. Healing time for these wounds. Artery disease is suspected. An ABI, or ankle brachial index, should also be measured. The blood pressures in both arms should be taken using the brachial artery. Then obtain blood pressure in both lower legs using the dorsalis pedis pulse. The highest value of the ankle blood pressure should then be divided by the highest value of the brachial systolic blood pressure. Are shoulders, ears, elbows, heels, sacrum, coccyx, the temporal and occipital portions of the skull, malleoli, ischial tuberosities, spinous processes, scapulae, metatarsals, femoral trochanters, knees, toes, body or skin along the edges of a wound. Providers need to determine if there is undermining and, if so, its exact location and extent. The evaluation process should begin at 12 o'clock, and using a cotton-tipped applicator gently probe around the wound margins in a clockwise direction. If undermining is noted, the applicator should be inserted using the same technique for determining tissue depth to measure the amount of undermining. Tunneling is a narrow passageway that can extend in any direction. In the United States, over 2.5 million people are diagnosed with pressure ulcers. In addition, 60,000 deaths are attributed to them during that same time span. The cost of caring for a single wound in the USA averages $70,000. That equals over $11 billion annually. There are many factors that the wound itself will have a deep, pale bed and a punched-out appearance. The amount of exudate is minimal. However, there will be dry gangrene, which is a result of poor blood supply to the affected area. During the initial phase of dry gangrene formation, the patient will experience pain at the wound site. At this time, the skin will appear dry and wrinkled, and the color is a dark brown. As the necrotic process continues, the hue changes to a dark purplish blue and finally to black. This is a very slow process, in which there is a clear line potential for devastating sequelae. Therefore, it is critical that high-risk patients and their families receive education about prevention, as well as the need for routine assessment and emergent care. Ultrasound is high-frequency sound waves transmitted through water or gel to the wound. When applied, tissue temperature and metabolic rate rise, causing enhanced oxygenation and removal of waste products. In addition, there are increases in macrophages, important that the wound itself be assessed per facility policy and with each dressing change so that healing can be noted or complications averted.